It's Patrick Hutzel from IntensiveCareHotline.com, where we instantly improve the lives for families of critically ill patients in intensive care so that you can make informed decisions, have peace of mind, real power, real control, and so that you can influence decision making fast, even if you're not a doctor or a nurse in intensive care. This is another episode of Your Questions Answered. And in last week's episode, I answered another question in this series of questions from our client Robert. And the question last week was part 9 of my 68-year-old mother is in intensive care with gastric perforation and she's not waking up after the surgery. Will she need a tracheostomy? And again, that was part 9 of this series of questions. You can check out last week's episode by clicking on the link below this video. In this week's episode of Your Questions Answered, I want to answer another question from one of my clients, Sue, which are again excerpts from email counseling and consulting sessions with me. The question this week is, my dad has end-stage HIV and is on ECMO in intensive care. Can he have a lung transplant? And that's part 1 of this series of questions. So Sue describes her dad's situation as follows. Sue writes, "Hello Patrick. Late January 2016, my dad had a diagnosis of HIV in the later stage. CD4 count of 4. Therefore, he received heart treatment late. Heart treatment is antiretroviral therapy. He was also diagnosed with MS 7 or so years ago, and he was an outpatient receiving regular treatment to manage the MS. I was told by the hospital that there is an investigation underway as my dad should have been given an HIV test years ago as a general procedure and that it may not be MS, but that he has an AIDS-related illness. From having the HIV test in January, he went home and was told he would receive a letter to come back to hospital. By the first week of March, my dad still had no letter, so his local GP told him to just turn up to hospital, where he was immediately admitted for an emergency assessment. At that point, he was only 40 kilograms and his usual weight is around 70 kilograms. And he had suffered from incontinence for about 5 months. After 2 days, he was moved to the immunology ward and was suspected of having PCP, which is pneumocystis pneumonia, after his breathing started becoming shallow. X-rays showed his lungs were very poorly with a lot of scarring. After 3 to 4 days, he seemed to get worse and needed more and more oxygen. Eventually, he was moved to ICU as it was found he got MRSA and a urine infection. The doctors and consultants there said he is in a very bad way, and overnight both lungs had collapsed. They didn't have an ECMO machine and there was nothing else they could do other than try a hybrid approach to support the lungs, but admitted they have not done this before. They were awaiting a hospital in central London that had the ECMO machine available. They were considering taking him. By the next day, the other hospital accepted to collect my dad. He has been there on ECMO for the last 13 days. They have been clearing up the MRSA and urine infection with a range of antibiotics, 4 or 5 different types. In the last 4 to 5 days, they found the specific pneumonia it was and started treatment along with the hard antiretroviral treatment. They started to wean him from the ECMO 72 hours from him being on ECMO. And all their regular attempts have failed so far. He still requires approximately 35 to 40% of oxygen, and yesterday he has started to require increased oxygen pressure. I was told a few things such as this was heading in the wrong direction and he's still the same, or no changes, whereas a week ago I was told he was responding well to treatment. They try to wean him every few days and he fights the tubes when they take him out of the induced coma, which aggregates his vital signs. My questions are, can he not get a lung transplant? My next question is, can I sue the hospital due to the late misdiagnosis and failing to test him for HIV? The HIV doctor said he must have had an HIV test for at least 9 or 10 years ago, but the same hospital was treating him for years as an outpatient for MS. Also, what questions should I be asking the doctors and the consultants? Next, is it possible they can bring him round and take the breathing tube out and put a tracheostomy in? I feel the hospital is leaning towards telling us his body is showing no improvements and it's in his best interest to switch the machines off. They have already said we cannot keep him on ECMO forever, but he has only been on it for 13 days. I forgot to say my dad is only 64. He went to the gym 5 to 6 times a week up until last year when he began having muscle weaknesses in one leg. The doctors are now saying they will assess his lactic acid or something like this to assess if he would be mobile after spending this length of time in a hospital in such a critical condition, also known as assessing quality of life. Best wishes from Sue. So here is my response to Sue. Hi Sue, thank you for being a client and thank you for using my one-on-one phone and email counseling and consulting and advocacy service. I really appreciate it. Thank you for sharing your dad's situation, and I'm very sorry to hear that he's in such a difficult situation. To give you a little bit more context, I have looked after many patients on VV ECMO, and I still do 1 shift a week in ICU at the minimum, and I do this at an ECMO center. To answer your questions, please listen to the following. So you're asking whether he can get a lung transplant. Yes, ECMO can be used as a bridge to a lung transplant. You are asking, can you sue to the late date or misdiagnosis and failing to test him for HIV? And because the same hospital was treating him for years as an outpatient for MS. With that information, I think you have a very strong case to sue the hospital, especially if you have documentation that supports your claim. You're also asking what questions should you be asking the doctors and the consultants. So the questions you should be asking are, what sedation is your dad on to keep him in the induced coma? You also should be asking, is he on any inotropes or vasopressors such as noradrenaline, norepinephrine, and or adrenaline or epinephrine? You should also be asking whether his kidneys are failing, and if they do fail, would they consider doing dialysis? You should also consider, have they tried to wean him off ECMO? And how are they trying to wean him off ECMO? Next, you should be asking, what is his blood clotting like? For example, patients on ECMO require a heparin infusion, which is a blood thinning medicine, to prevent blood clots from forming during ECMO therapy. And you should be asking your dad, what ventilation settings is he on, and do they think the ventilation support would be sufficient to wean him off ECMO? Once you have that information, I can give you a much clearer picture of what is to happen next. You may also want to look at some related articles and videos about how long can a critically ill patient stay on ECMO, and also how to wean off ECMO. I put some links to these articles and videos below this video in the written version of this blog. And also, if you're watching this on YouTube, go and click on the link below this video. That'll get you to our website. Next, Sue, you're asking, is it possible they can bring him round and take the breathing tube out and put in a tracheostomy? Now, the answer to that question is, in principle, absolutely yes. Your dad would be on heparin for the ECMO, and heparin is a blood thinner, as I mentioned. Depending on how much heparin he's on and how thick or thin his blood currently is, they may be reluctant to do a tracheostomy. However, most of the time, with foresight and planning, they should be able to do the tracheostomy. For example, they could stop the heparin before doing the tracheostomy and potentially also give FFP, which is fresh frozen plasma blood products, to improve the blood clotting. Again, they have to weigh up the risks between bleeding because of the heparin and performing a tracheostomy, and also the risk of blood clots developing whilst on ECMO. Also, Sue, you mentioned that they want to assess quality of life. Quality of life is something very subjective, and they're also talking about a future perception of quality of life. They're trying to assess something entirely hypothetical, because nobody knows what the future looks like. That's just some food for some thought for you. My best is always that everything in life is negotiable, including treatment for critically ill patients in intensive care, if you know what to look for and if you know how to position your dad's diagnosis and prognosis. The answers that I have given you up to this point should be your first points of discussions with the intensive care team to get the ball rolling and find out where you stand with, first, weaning off the ECMO and using ECMO for the potential of a lung transplant. Overall, I would say that your dad is certainly in a very critical condition, and if they can't wean him off ECMO, there is a very high risk they may say that he's not a candidate for a lung transplant because of his progressive HIV. But again, you need to ask and enter those discussions in order to find out. 13 days on ECMO is an average time, and I personally have seen critically ill patients on ECMO for up to 3 weeks, but I do know that timeframes can vary significantly, and I have heard of cases where ECMO was being used for up to 8 weeks. Please also have a look at other consulting sessions that I've done with other clients in the past who had loved ones on ECMO, and again I put the links below this video to those other consulting sessions. So, how can you become the best advocate for your critically ill loved one? How can you make informed decisions, get peace of mind, control, power, and influence quickly whilst your loved one is critically ill in intensive care? You get to that all-important feeling of making informed decisions, getting peace of mind, control, power, and influence when you download your free Instant Impact Report now by entering your email below. In your free Instant Impact Report, you learn quickly how to make informed decisions, get peace of mind, real power and real control, and how you can influence decision-making fast whilst your loved one is critically ill in intensive care. Your free Instant Impact Report gives you in-depth insight that you must know whilst your loved one is critically ill or is even dying in intensive care. Sign up and download your free Instant Impact Report now by entering your email below. In your free Instant Impact Report, you learn how to speak the secret intensive care language so that the doctors and the nurses know straight away that you are an insider and that you know and understand what's really happening in intensive care. In your free report, you will also discover how to ask the doctors and the nurses the right questions, discover the many competing interests in intensive care, and how your critically ill loved one's treatment may depend on those competing interests. How to eliminate fear, frustration, stress, struggle, and vulnerability, even if your loved one is dying. You get 5 mind-blowing tips and strategies helping you to get on the right path to making informed decisions, get peace of mind, control, power, and influence in your situation. You'll get real-world examples that you can easily adapt to your critically ill loved one's situation. How to stop being intimidated by the intensive care team and how you will be seen as equals. You'll get crucial behind the scenes insight so that you know and understand what is really happening in intensive care and how you need to manage doctors and nurses in intensive care, and it's not what you think. Thank you for tuning into this week's Your Questions Answered episode, and I'll see you again next week in another update. Make sure you also check out our blog section for more tips and strategies, or simply send me an email to support@intensivecarehotline.com with your questions. Or you can call me, find international phone numbers on our contacts tab. Also, check out our ebook section where you get more ebooks, videos, and audio recordings, and where you can also get one-on-one counseling and consulting with me via Skype, over the phone, or via email by clicking on the tab on the top of the website. This is Patrick Hutzel from intensivecarehotline.com, and I'll see you again next week in another update.